This is the human heart. Today we're going to look at the anatomy of the heart. This structure is the thymus gland. And I'm going to go ahead and remove it because it's in the way. This structure right here is the right atria. This is the right ventricle. This is the left ventricle and the left atria. These ear-shaped edges of the atria are the auricles. This is the auricle of the right atria and the auricle of the left atria. This is where the interventricular septum is located. The surface of the heart is called the epicardium. The blood vessels that feed into and drain from the heart are the superior vena cava. The inferior vena cava is under the heart, and we're going to look at that in a minute. This is the ascending aorta, the aortic arch, and the descending aorta would be behind. And this is the pulmonary trunk, which leads to the pulmonary arteries. The superior vena cava branches into the right brachiocephalic vein, the internal jugular vein, and the left subclavian. The aortic arch branches into the right brachiocephalic, left common carotid, and left subclavian. And this branch back here of the vena cava is the azygos vein. Behind the heart, these are the pulmonary arteries. Even though they're blue, they're carrying unoxygenated blood. They are arteries because they are carrying blood away from the heart. These are the pulmonary veins, which bring blood back from the lungs to the heart to be pumped out to the rest of the body. And even though they are red, they are veins because they are carrying blood towards the heart. And this right here is the inferior vena cava. Also, we have this structure, which is the ligamentum arteriosum. In the fetal heart, that would be the ductus arteriosus, which would allow blood to pass through and be diverted from the lungs. This is the left recurrent laryngeal nerve. The blood vessels that feed the heart, we have here, this one is the coronary sinus. That is the main coronary vein. This underneath the atria, which is going to be really hard to get to, is the left coronary artery, and it branches into the circumflex arteries. This is the left posterior vein. This is the great cardiac vein along the interventricular septum and the anterior interventricular artery. Let's see if I can put this guy back together now. Of course I can't. This is the marginal artery, and underneath the right atria is the right coronary artery, and this is the small cardiac vein. And down the middle of the back is the middle cardiac vein and the posterior interventricular artery. I think that's all the surface features of the heart. So we'll just start tracing blood flow through the heart and look at some of the internal anatomy. Blood enters the heart from the body through the superior and inferior vena cava. Inside the right atria, we have a part of the fossa ovalis, which in the fetus would be the foramen ovale, and would allow blood to pass between the two atria. Right here we have the outlet for the coronary sinus, which allows blood that has oxygenated the heart to return to the venous blood supply into the heart. Blood enters the atria and passes through the atrioventricular valve. On this side, it is called the tricuspid valve. Into the right ventricle. These are chordae tendineae, and they open and close the heart valve. They're connected to the heart valve. And these are papillary muscles. This right here is the interventricular septum, and it is the wall between the two ventricles. These are the layers of heart muscle. This top layer, as we talked about, is the epicardium. The middle is the myocardium, and the internal surface is the endocardium. Blood has come from the body into the right atria, through the right atrioventricular or bicuspid valve, into the right ventricle, and now passes through the pulmonary semilunar valve, right here, into the pulmonary trunk, where it goes to the lungs through the pulmonary arteries to be oxygenated. When the blood returns from the lungs, it will enter the left atria through the pulmonary veins, which are right here. In the left atria, we can see the other remnant of the foramen ovalis in the newborn, which is the fossa ovale. And the blood will come from the lungs into the left atria, pass through the bicuspid or mitral valve, and this is another atrioventricular valve, the left atrioventricular valve, into the left ventricle, where we see more of the chordae tendineae, same as in the right ventricle, and the blood will pass through the aortic semilunar valve way up in there into the aorta to the rest of the body. And I think that that's about it. That is the anatomy of the heart.